There's 5 life stages on here. We have puberty, your fertile years, perimenopause, menopause, and then post-menopause. When you think about a woman's hormonal journey through these different life stages, what is the sort of advice you would give them to make sure they're hormonally healthy across every life stage? What are like the basics? What are the tactics, strategies, medications that they should be thinking about? And I say this because I've got women in my life at every stage in this life phase at the moment. I've got my nieces in the sort of puberty era. I've got my fiance in the fertile years. I've got my mum and grandparents, etc., in the peri and post-menopause years as well.
Yeah. So if you look at your nieces, for example, when they were babies compared to now, there are changes happening. Their bodies are transforming because they're getting a surge of hormones in their body, and that's estrogen, progesterone, and testosterone. They're cycling, which means they're getting periods. So let's talk about the menstrual cycle for a second. I think it's helpful.
Okay.
So when women have their period, they bleed for a few days, right? And that's when their hormones, their estrogen and their progesterone is at its lowest. Okay?
Okay.
So hormones are at their lowest. And then the hormones start to increase. Your estrogen starts to go up. You don't make progesterone yet in the beginning. Your estrogen starts to go up, and there's a follicle in your ovary, which has an egg, right? It's going to pop out an egg. Ovulation is when the egg pops out. So you get this big surge of estrogen. And then when the egg pops out of the ovary, right, that's what's going to make a baby if it gets fertilized, there's a shell of the egg, right? The egg has a shell, which makes progesterone. So the second half of the cycle, there's progesterone around. Okay, first half of the cycle, no progesterone. And so that second half of the cycle, the shell is making progesterone. And then when you don't have fertilization, the shell starts to break down.
Okay.
And that natural breakdown is a drop in progesterone, which causes the lining of the uterus to shed, and you get a period again. And so it's estrogen goes high in the beginning and then pops out an egg. Progesterone gets high in the second half, then they both fall and you have a period. And so the hormones being low in the beginning, estrogen is not 0. It's about 50. Okay, so when we talk about numbers, if you get your hormones checked, if they're at their low, it's like 50. But when you ovulate, your estrogen may be 150, 200, 300. And then when you're pregnant, your estrogen may be as high as 3,000 or higher, right? It's very many thousands. And so these hormones have actions in our bodies. And so the reason it's important is because when we give back hormone therapy, well, are we giving back 10,000 like pregnancy? No, we're giving back to be like 50, 60, 70, the way that you are early in your cycle kind of a thing. Now, testosterone's not even on this graph that everybody gets taught of estrogen, then progesterone, but we do know testosterone is pretty stable through the cycle, although we do believe it peaks during ovulation, which makes sense because you want to have a baby, right? So evolution says, okay, you need to be horny around the time that you are going to ovulate. And so your testosterone starts to go up. Now, it's really important because you're probably not having a conversation with your nieces about their menstrual cycles, but it's a problem because no one's talking about it if they're painful, if they're abnormal, if they're, we don't have a lot of conversations around what is a normal amount of bleeding. We have so many people who have problems, whether it's PCOS, which is now called PMOS, which is a metabolic issue that causes you to have irregular periods. There's endometriosis where you have painful periods. There are so many medications we give to people that can alter their hormonal health and sexual health for that matter. And then it all starts to get even more chaotic in perimenopause, which is again, age 35 to 45. If menopause, we say is 45 to 55, right, is normal menopausal age. Average age is 52. And we think perimenopause is when things start to change for people about 10, and it can be about 10 years. That means 35 to 45. So how old are you? I don't remember.
33.
33.
And my partner's 33.
All right. So 33. So this idea that I'm too young or it's too early or I'm not there yet, the truth is things do start to change.
What changes for a woman?
So there are so many symptoms to hormonal fluctuations. So for some people, it's temperature changes. For some people, it's fatigue. For some people, it's remembering things. For some people, it's low libido. Some people get dry eyes, itchy ears, burning mouth, joint pain. Some people get irregular periods. Some people get pain with sex. Some people get UTIs. I would love to talk about why hormones are so important for the bladder and UTI prevention. And so there are so many symptoms, and everyone says, oh, we're blaming everything on hormones. And the truth is, we haven't talked about hormones enough to actually start looking at this to figure out what is important and what is hormonally important.
So when you start to lose progesterone, when you arrive at perimenopause, what are the symptoms you feel? Are they different symptoms to decline in estrogen?
So it's hard to know for sure, but some people think that is the progesterone. So your sleep starts to get a little crazy, anxiety starts to go up. And so some people will start with progesterone as a support for, sort of perimenopausal hormone therapy. But estrogen can also help with many of those symptoms. So it's not a one size fits all of whether we give people, everybody gets progesterone or everybody gets estrogen. Sometimes people just get testosterone because remember that falls in your 30s. So there's some times where we do all three, and there's sometimes where we do just one or two. Now, it's a very evolving conversation because most of the book answers, most of the guidelines really talk about menopause and how we treat people in this menopause when you're flatlined. Remember, it's that castration event where everything's zero, and then we add back hormones. So now we're starting to talk about perimenopause as a place to start giving women hormones, and that's a very important and evolving conversation that is happening.
And so this conversation that's sort of raging on about HRT, about safety, about what age you should take it, who should take it, what form you should take it in. What's your perspective on that, and what do women need to know about that?
Yeah, so it's important because...
And what is HRT?
Yeah, it's a great question. So hormone replacement therapy, which is a term that we used to use for hormones in menopause. It has a bunch of different names and everyone tries to change the marketing around it. But hormone therapy in general is this idea of giving back hormones when you have hot flashes, night sweats, osteoporosis, sort of this over 50 crowd that has these declining estrogen and progesterone levels. And so typically classic hormone therapy is estrogen and progesterone. Now, again, taking just estrogen grows things. It helps your bone health. It helps your hair, skin, and nails. It helps you not have hot flashes. It helps you sleep. It can also grow the lining of the uterus. And so if it gets thicker, there is worry over years that leads to endometrial or uterine cancer. So the endometrium is the lining of the uterus. So here so this is a vagina. And then at the vagina is like a sock. At the very end of the sock is a tiny hole, and that hole is the pinpoint opening of the cervix. And that hole, if you go through that tiny, tiny hole, it gets to the uterus. And the uterus is a cavity where we hold babies, where the lining comes out. That's what period blood is the lining of the uterus here, which we'll call the endometrial lining. So progesterone is very important for this lining here. If the lining of the uterus gets too thick with just estrogen, that can lead to problems. But if you match it with progesterone, those problems go away. So
so if you just gave someone estrogen, then the linings of the uterus would get so thick that would cause a problem. But if you give it to both hormones together, it sort of balances itself.
It balances them out. And so that's why you'll hear hormone therapy talked about estrogen and progesterone, just like the birth control pill your partner was on was an estrogen and a progestin. There was a combination.
Okay, got you.
And also the history is kind of important here of why your mothers and grandmothers weren't given access to this medication and the stigma behind it. In the late 90s, a lot of people were on hormone replacement therapies and they were seeing benefits. They actually were all these observational studies that showed, wow, the heart disease is less. And
during menopause.
And $1 billion went into the NIH to study this in women. And it was called the Women's Health Initiative. It was thousands and thousands of people aged 50 to 79. They gave a hormone pill, like a birth control pill almost, to all of these women, and they followed them. And they stopped the study early in the early 2000s, and they did a press conference. And at this press conference, they said, we're shutting down the study early. Hormone therapy causes cardiovascular disease and breast cancer. And overnight, a multi-billion-dollar industry went to nothing. Everyone was told, throw your hormones in the garbage. This is dangerous. What was crazy is those people who were prescribing hormone therapy were looking around saying, I don't understand. My patients aren't dying of heart disease. They're not getting extra breast cancers. This doesn't make any sense. And when people actually looked at the study, it didn't say any of those things. It was wild how misinterpreted this study was. In fact, the same authors of this study back in the early 2000s published this year in 2025, actually, that below age 70, that type of hormone therapy, which we don't really use anymore, has no increased risk of cardiovascular disease or stroke. And yet now you have a generation of doctors who weren't taught how to do this. Only 1.7% of women are getting prescriptions for hormone therapy who should be offered prescriptions. So it is a disaster.
Only 1.7%?
Only 1.7%.
Oh, really? Wow.
And so hormone therapy is not something that I'm saying every woman must have, but every woman should have access to the toolbox. I like to think about hormone therapy as really 4 buckets that we talk about. Hormone therapy is whole body estrogen, which helps with hot flashes, night sweats, bone loss. Progesterone, whole body progesterone therapy, which protects the uterus and is this yin yang, especially if you have a uterus, but it helps with sleep and it can help with anxiety reduction in many of our patients. Not everybody, but a lot of them. The third thing is testosterone, which we talked about, which can help with libido. That's what we have the most evidence for. And then the fourth thing is vaginal hormones. Now, vaginal hormones are microdoses of estrogen, or what we call DHEA, vaginally, that supports the bladder and the vagina. So it helps with pain with sex, dryness, urinary frequency, urinary urgency, leakage, and it prevents urinary tract infections massively. It is safe for your great-grandmother in the nursing home. It is safe for your wife who's breastfeeding. So if you know anyone in your life who is a woman who's having urinary frequency, urgency, leakage, urinary tract infections, pain with sex, dryness, there is a magical solution that is safe for everybody on earth that is microdosing these hormones vaginally.
At any age?
At any age at all. In fact, even more important for people who are older because they are dying of urinary tract infections.
They're dying of it.
It's one thing when a young person gets a urinary tract infection and they go to the urgent care and they get an antibiotic. Even they deserve prevention, and this prevents those problems in those people too.
Again, what is this?
So vaginal hormones. So this is a really important topic. It's called genitourinary syndrome of menopause, or GSM. Say GSM loudly for your listeners.
GSM.
GSM, genitourinary syndrome of menopause. Genital, urinary, syndrome of menopause. But really, it's kind of a dumb name because it's any hormonal changes in your body can affect the bladder and the genitals.
So UTI, what is a UTI and what's causing a UTI? Urinary tract infection?
Yeah, very good. So urinary tract infections are when there is bacteria in the bladder, and it can be a lot of bad bacteria that can grow and create inflammation. It causes bladder pain with urination. It feels like razor blades, but it can also go into your bloodstream and cause fevers and chills. It can cause kidney infections. It can cause something called urosepsis, where you have to go to the intensive care unit and need antibiotics through an IV, and it can kill you if you have an infection go through your whole body. And this gets worse and worse as you get older.
Why is there a link between hormones and UTIs?
Yeah, because what happens is the vagina is supposed to be acidic and healthy, and hormones help keep it. It is the hormones, the estrogen and the testosterone, that keep healthy bacteria growing in the vagina and suppress or lower the bad bacteria.
So there really is a vagina microbiome.
There is, and there's no probiotic on earth that is proven to do what the vagina needs quite like hormones. Hormones make the tissue go from not acidic to quite acidic, and it is that acidic environment that protects it from infection. And so perimenopause and menopause or other situations happen, and it changes that microbiome, so the good bacteria are lower and the bad bacteria start to grow, which can increase your risk of infections. And sex, right? Sex is a contact sport. So you're bringing the outside environment into the inside environment. Ejaculate is also not acidic, and that can change the microbiome as well. And so we know women who are sexually active also have an increased risk of urinary tract infections. So again, like a plant needing water, vaginal hormones help support the vagina and the bladder to maintain that acidic environment. And research has been clear since the 1990s that using vaginal hormones prevent UTIs, urinary tract infections, by more than half.
So what have we got here in front of me?
All right, so there's a bunch of different ways you can give yourself vaginal hormones. The most common way is a cream. Now, this cream is $14 on Mark Cuban's pharmacy, and it lasts about 2.5 months. Now, this cream, that comes with an applicator, which you don't ever have to use if you don't want to. But what you can do is you want to use 1 gram of this cream. So this amount is 1 gram of this cream. We'll put it on this paper here to show you. 1 gram of this cream rubbed into the vagina. So you can take it on your fingers and rub it into the walls. Like if you put sunscreen on your face, you don't blob it on and walk out the door. You rub it in so it doesn't look all white and filmy. So you put it in, you take it with your finger and you put it in the vagina and you rub it into the walls of the vagina, and you can rub it on the this area as well at the opening.
Let me try it. Look, I don't have a vagina, but
oh my gosh.
So you take what is this cream called?
It's estradiol cream.
Estradiol. Take it on your finger. You rub it inside the walls of the vagina.
And just rub it in like you would rub sunscreen on your face. And if you do that twice a week, you can prevent death from urinary tract infections. You can help with urinary frequency, urinary urgency, leakage. You make sex not painful and dry. It helps with arousal and orgasm. It's literally better than Viagra. And this is over the counter in the UK. In the United States, you need a prescription, but it's as little as $14 if you use Mark Cuban's online website. It should be covered by your insurance. Now, some women hate creams, and so we have things that are not as messy as what you're showing right there. And we have little tablet inserts. So here it comes with an applicator. And so what a woman does is put this in her vagina and press a button and this little tablet. So instead of a cream, you could just put this little tablet in twice a week, and that does the same thing as the cream.
Ah, okay.
Okay, so it's a little less messy. So people tend to like the creams better. Now, if you really don't want to do anything twice a week, this is a ring that goes in the vagina and it can stay in there for 3 months. Now, it's sort of like a tampon. You can kind of put it in the vagina and the vagina does not feel it. By the way, the vagina is not very sensitive in terms of nerve endings. And so when women put tampons in, they don't feel them. When you put this ring in, that you wouldn't feel it either, and it would stay in for 3 months at a time.
It's quite a big ring.
Vagina can hold like a bowling ball of a baby can come out of a vagina. So it can actually withstand quite a lot of volume.
And there's a chemical inside this ring that's going to diffuse
estradiol
out.
that slowly diffuses estrogen for the ring. So that's nice for women who have dementia, who have very bad dexterity with their fingers. They're in a nursing home. For someone who's on the go and they can't remember something twice a week. So our ADHD patients like things like that. And so there's just different, it's all the same stuff. It's just in different formulations. Now, the one different one, this is something called DHEA. Now, DHEA is the precursor hormone to estrogen and testosterone. And remember, I said the vulva, the vagina, the bladder need testosterone too. So this is a chemical that converts into estrogen and testosterone. And so DHEA is a supplement you can buy, sort of in the supplement aisle. But if you put it locally in the vagina, this is an FDA approved product. It's called Intrarosa. And if you just put this in the vagina, it's meant for every night, but you can do it twice a week. It melts at bedtime when you wake up, and it prevents UTIs. It helps with pain with sex.
And just to be clear again, so you think a lot of people should be taking these things?
I believe it's preventative. So I think, and we wrote guidelines by the American Urologic Association, why this is so important, how to do it. So many women have symptoms of urinary frequency, urgency, leakage, urinary tract infections, pain with sex, dryness. And this is a safe option for all of those women. Does that make sense?
It does make sense. And one of the things that doctors sometimes tell their patients to take to help with the UTI situation is that.
Okay, this is a disaster. So women get urinary tract infections a lot. And so what do we tell women? Pee after sex, wipe from front to back. Like, that's not data driven, by the way. That's all a folk tale. Like, that's folklore. There is some data that cranberry pills can help with preventing UTIs, but the amount that you'd have to drink is very sugary and diabetes inducing, and it wouldn't taste that good. And so they do make pills, but these things are small things that help. Drinking lots of water can help. But vaginal hormones, vaginal estrogen or vaginal DHEA, which we just showed a bunch of, prevent UTIs by more than half. They don't just prevent UTIs, they help with urinary frequency, urgency, leakage, pain with sex. They help your arousal, they help your orgasm, and they're safe for every age with every medical problem. If you've had cancer, blood clot, stroke, any problems at all, vaginal hormones are safe and could save your life. And so this is such an important topic.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.